Well, to start with, I found I had a pain in my face. It's very small. I couldn't figure out what it was, so we did a bunch of x-rays and finally found out that I had a abscess on the end of a root canal, which was about 30 years old. At that time, I had the abscess removed. And after that, which has been about 3.5 years, I've had pain in this area of my face. And it also reflects up around your eye and your eye muscles. I went to all of the known neurologists, and they said I had trigeminal neuralgia. Okay, this to me was explained as a nerve situation in the back of your neck, not at your nose. Well, that is when I decided then to go to a prominent facility to have a operation, which my wife will explain to you what it is.
We were referred out of town to the Los Angeles area for some expert therapy on Norman's pain area, and seeing neurologists in the Los Angeles area, we learned that there's a procedure called stereotactic radiosurgery, and I brought a picture here for you to see. They put a halo on your head and 4 bolts into your skull, and you wear that from about 6 o'clock in the morning till about 3 o'clock in the afternoon, while the computer decides where they're going to shoot the radiation into your brain. And then after they apply this apparatus, and I've got some more pictures here of them putting it on. This is a picture of it after it was put on Norman's head. This is from the back view. And you can see the bolts right here that go into your head. They literally screw them into your head. The prongs are about the size of a pencil lead. This is a front view. Then after that, they take you in a room and they bolt your head to the table and they strap you down on a table. And then this machine right here, which is called the Novalis, is what shoots the radiation. And they put a line of radiation and a lesion on your nerve so that it'll confuse the area and stop transferring pain to your face. It didn't work. After several trips to the Los Angeles area and going through this procedure, Norman was told that within 3 to 6 months he should have no pain, or before. It didn't work. He continued to have excruciating pain. Feels like a taser gun in your face. And when it strikes, he was totally debilitated. On the floor, screaming, horrible pain. Just couldn't stand it. So we went to another physician, and we were referred to, again, a different facility in Los Angeles. We went up there again, and they were either going to repeat the first procedure, the stereotactic radiosurgery. There were 2 other primary care methods that they use. One, they go and they take a plug out of your head, out of your skull. They go in with probes and magnifying glasses, and they put several Teflon wedges in between the vessel and the nerve. The theory being that over years we have a substance that protects nerve endings from touching each other and hurting, whereas as you grow older they disintegrate a little bit, so when they rub together they cause extreme pain. This particular procedure takes several hours under major anesthesia, and my husband Norman is not a candidate for major surgery right now because he has a compromised immune system as well as an artificial heart valve. The second procedure recommended is they go in, not called major surgery, and they put little balloons in between the nerve and the artery and vessel. The unfortunate part of these two procedures is they're not guaranteed. They may not last forever, and the second balloon procedure may have to be repeated every couple of years. The stereotactic radiosurgery is not recommended more than twice. Having gone through that once and it not working, Norman's not prepared to do it again. So we were sort of beside ourselves in what we could do to stop his pain. It was called and has been called the suicide disease because it's so excruciating, it's almost impossible to live with. The next thing that happened, some friends of ours recommended Dr. Feld, and we were quite skeptical at first. In fact, we were totally not against it, but we were very skeptical. And then after a time, it got to the point where, hey, you know what, let's go for it. Let's see what we can do. Maybe the man has some magical answer and can help us. So we came to Dr. Feld, and he diagnosed Norman as having a problem in his TMJ joint. I believe they call it the pteromandibular joint, where your jaw and the side of your head, right in front of your temple, in front of your ear, comes together. As you open and close your mouth, you can feel that joint. Dr. Feld also recommended making 2 appliances, one for all day and one for evening. My husband has been without pain for over a month now, and that's after 3.5 years of unbearable, excruciating pain. We are very thankful to Dr. Feld for his procedures.
When the man said he could fix it, after the extensive x-rays that he took, which I've never seen before, no one else took any x-rays, then you can start to understand what's going on in your face. I never did believe that the pain at my nose wasn't there. Everybody told me it was in the back of my neck. Well, that's when we found out the pain wasn't in the back of my neck. The pain was right there, and the problem was right there. And I have not been bothered with it since. It's on top of my original. This is one I've had for over 30 years. And Dr. Feld made this, which goes on top of it, with the idea of pulling my jaw down to let the joint expand and repair itself. Right on top of a partial. All it does is it clips together, and I wear this in the daytime, and that's what you eat with. And I didn't bring the one for at night. It's just to keep your teeth apart. And you don't even know this is in your mouth. And I've had no pain since the third treatment. The first 2, it stopped it, but I still was getting a tickling and a little pain. And then the third one, which it quit, I had it on a Friday, and Saturday it bothered me all day, and Saturday night it quit and has not bothered me since. The pain was excruciating, and then you never knew when it was going to hit you. It might hit you 2 times in an hour, it might hit you once or twice in 2 days, or it might hit you every hour for 24 hours. You never know what this pain is going to do, and when it hits, it is so severe that your eye starts going bad, and it hurts so bad you start to cry. And that's when you land on the floor because you can't stand the pain. I couldn't blow my nose for over 2 years. The vibration in my web here, but in your nose, would hurt so bad I couldn't stand it. So you don't blow your nose, you just wipe or do whatever. But I could not blow my nose. Now I can blow my nose. I can also shave. I couldn't touch this area with anything. It just make excruciating pain. Try to shave or anything, it was impossible. Now I can shave, I can blow my nose, and I have no pain whatsoever.
I would cry my heart out because I was totally helpless. I would get him ice packs. I would get him a hot cup of water. He wouldn't necessarily drink the water. He would put the hot compress against his face like that, and sometimes it would help and sometimes not. He would go back and forth. He would try everything. His nose and face was in every configuration you can imagine, and nothing would stop it. When it was ready to quit, it would quit. It didn't seem like there was any one thing that would make it stop. And the physicians and the specialists that had worked on Norman's root canal and done the surgery had no clue. They were experts in their field, but they didn't take the time to take care of their patient. It didn't seem to be of interest to them that this man was in agony 24/7 with this excruciating pain. It was just a non-event to them. We were totally, totally amazed that none of the other physicians in this community, or in the Los Angeles community for that matter, were willing to take the time to take care of their patient.
I feel that Dr. Feld is probably one out of maybe
Truly a humanitarian person.
thousands of doctors who is interested in pain and problems that you have more than just his specialty of being a dentist. Pulling teeth, root canals, and that was it. He is a person that is looking farther into pain, which is caused by your jaw, your teeth, your face, and your neck, which is the control of all your body. The nerves in the back of your neck, and then they go run up through by your ears to your face, are the nerves and the controlling part of our complete body, as far as I'm concerned. Now, Dr. Feld is a person who, to me, is in a new field, which I never heard of, and I hope they can do more to help people, because there's a lot of people with pain and ear problems and jaw problems that nobody is going to cure.
I think Dr. Feld and his staff are all committed to the patient. I've been very impressed by the camaraderie that they all have together. They're all professional. They are very responsive and respectful of our concerns and our feelings. There was a time when Dr. Feld was not available and I was very upset. They calmed me down, called Dr. Feld. He made special arrangements to see Norman, realizing that Norman was again in pain. We took care of the issue. I've never had that happen in my whole life with a physician. It's just remarkable, the care and the camaraderie. I've just been very impressed with the girls. They are all very, very compliant. They're all professional, like I said. They know their job. They take care of the patient. They're very courteous. And I think Dr. Feld has done a remarkable job in their training and the camaraderie that they have with each other. I recommend anyone that's in a lot of facial pain to talk to Dr. Feld. Perhaps he can help them, perhaps not, but at least they'll have a professional that really does care about the patient. A very uncommon thing in today's life and world that we live in.